I'm just curious. You mentioned your research, right? And I know you did. This was part of your dissertation, I guess, when you were in graduate school. And
PhD, yeah.
yes, okay. And you made some important discoveries. You were saying, right,
Yeah.
about how people heal from betrayal. Can you share? I mean, I know you also have a book on this, by the way, right, Dr. Debbie? But maybe you could share just a little bit about the discoveries that you made and how people, and how they change, I guess, or how we even think about our approach to healing after a betrayal.
Yeah. So the first discovery was the one that I just shared, that healing from betrayal is a different type of trauma that needs a different way to heal. And if you try to heal it as if you were trying to heal from the pain of losing a loved one or disease, it does not work. So that betrayal is a different type of trauma that needs a different way to heal. That was the first discovery. The second one was that there's actually a collection of symptoms, physical, mental, and emotional, so common to betrayal, it's now known as Post Betrayal Syndrome. And we've had over 100,000 people take our Post Betrayal Syndrome quiz on our site to see to what extent they're struggling. And a few things about that. The first thing is we've all been taught time heals all wounds, right?
Yeah.
Well, I have the proof that when it comes to betrayal, that's not true.
Yes.
There's a question on the quiz that reads, is there anything else you'd like to share? And people write things like, my betrayal happened 35 years ago, and I'm unwilling to trust. My betrayal happened 15 years ago. Feels like it happened yesterday. So we know we can't count on time. We can't even count on a new relationship to heal it. Healing needs to be deliberate and intentional. And every few months I pull the stats from the quiz, happy to share them if that would help.
Yeah, I'm curious just in terms of time, because I see this as well, by the way, in my field, but I'm curious what your impression is. Like, what happens that just the passage of time, for instance, is not enough to heal all wounds? Like, in other words, what's going on with that individual that doesn't help?
Yeah, and that's exactly what the third discovery was about. So I can dive into that one. What we learned was while we can stay stuck for years, decades, a lifetime, and most people do, if we're going to fully heal, we're going to move through 5 proven predictable stages. And what's even more exciting about that is we now know what happens physically, mentally, and emotionally at every one of those stages. And we know what it takes to move from one stage to the next. Healing is entirely predictable. Happy to share the stages if you want to hear them.